Hello, everyone. I'm Lucille Bessler, and I'm joined today by Marcia Schofield. We call ourselves the Money RDs because that's what other people call us. So I'm going to hand it over to Marcia to talk a little bit about our goals for today.
Thank you, Lucille. I know we're excited to have this conversation because it's a really important one. But our overall goal with Money RDs in today's program is we want to pay it forward. We just want to help you be successful with your MNT business. So today we're going to explore how to negotiate contracts with payers. Perhaps we're not telling you anything you don't already know, but we're in the same boat and we need to support one another. So, Lucille, you have years of experience negotiating contracts with commercial payers and even Medicaid. So, how do you get started preparing for those negotiations?
Really great questions. Great questions. And the whole process can be very overwhelming to people. The things that you need to be aware of is that first, we at one time could really negotiate fees and negotiate a little bit more forcefully than we can now. Now, many of the insurance companies have set fees for MNT. Their fees are set based on where you live, kind of like Medicare does, right? The region you're in. So you need to know that. Don't go into a negotiation thinking you're going to get the world because you're not necessarily going to do that. But I think planning ahead, you're going to get the best deal you can. So some of that planning ahead, first of all, I always say, and I know you say this too, Marcia, do your homework. Know who in your community is providing the services that you're providing. Because guess what? That is a negotiating strength. If no one else within a 50, 100-mile radius is providing MNT, even face to face. I know we're doing a lot of telehealth, but there are still a lot of people who do want that touch point. They do want to
Mhm.
see you. So do your homework, see who else is out there doing what you do. Then again, before you approach the insurance providers, think about your specialty. Are you a, a diabetes specialist? And so is that your area? Again, because you might be offering different things, even though it's MNT, nutrition counseling, you still might be offering different things that would make you more valuable to their network. So do your homework there. Then it's how to get to these provider relations representatives.
Right? They tend to hide, right?
They tend to hide a lot. And I think that many do not even, you can't even contact them. I will tell you, we had one issue with one of our insurance, um, and we were trying forever to get the provider relations rep, and we couldn't. Finally, I found that person on LinkedIn, and I sent a message on LinkedIn. Not that she was very happy with that at all, but then maybe you should have answered your voicemail or your emails. So mostly everything is done through portals now.
Mhm.
You know, if you wanted to become a United provider, then there's a portal. And so if you could get to someone, it's a lot of homework, it's a lot of digging. So research, look in your area, use my little trick with LinkedIn. Try to find who the local, you know, offices for that insurance and try to see if you have a provider relations specialist that is assigned to your area and that you can contact. And then you want to obviously sell yourself. They might say right away the network is closed. And that's why, again, you want to really showcase your, specialties and things that you do.
I think those are, some really important points in there. And there's some of the skills you just need in general for your business, right? You need to do your homework. You need to be persistent. You need to be creative and resourceful. And you really don't be afraid to promote yourself, right? That's one of the things you're saying is don't be shy about it. You don't have to do it in a bragging manner or an offensive manner, but you should feel confident about what you bring to the table. Like you said, what are the unique things that you can offer this company, and just professionally bring that to their attention, right?
I think, Marcia, you hit on something that's so important. And sometimes what we forget to do as dietitians, we might be so busy in the day to day and it gets overwhelming. You need to collect outcomes because you can report outcomes. So I will always say, because we did gather, stats on individuals with diabetes, how many times they came to see us, what kind of decline did we see in hemoglobin A1C. So I can report to these people after 3 visits to us, their hemoglobin A1C declined by 3 points. Now, understand you're talking to a provider relations representative. They're not always a clinical person, but if you are, putting documents out there and those documents are shared with any of the medical directors, that is really good. But I think that it really helps because it shows that you really value outcomes and your practice works very hard at getting those outcomes. Really important.
And that speaks in their terms. Even if that provider relations person isn't a clinician, I'm sure they are trained to think about increasing members, member satisfaction, saving the bottom line, right? And that's what you've just demonstrated to them. And you just may need to connect the dots in that conversation. These are my outcomes. That'll bring you more members because they know we can get results. That will also help your company save money by us getting these better results. They won't need those other more expensive services. So that should be music to their ears if you just frame it the right way.
I think
Um,
so. And you know what else I think? It's funny, Marcia, every time we have these conversations, they go in different directions because there's so much information. I think those outcomes are very important, and we seem to forget that. The other thing is, too, when you're negotiating these contracts and these contracts are in front of you, make sure that it's the CPT codes that we use. Make sure they're in there in the contract, because sometimes you again, talking to a provider relations representative, they don't really understand the difference between an RDN and someone who's providing nutrition services as opposed to physicians who provide nutrition services. So make sure those codes are in there, those MNT codes, and then make sure that the diagnosis codes that you see the most frequently are ones that are going to be covered. This kind of nightmare, when you think you have a contract and you think you could see these people, and then you start using diagnosis codes and they say, oh no, we don't cover that. We cover MNT for diabetes and chronic kidney disease. We don't cover MNT for weight management. Then, you saw a whole bunch of people that you're not going to get paid for. So do remember that. That's very important.
yeah, that's part of the homework, right? Before you decide you want a credential with a company, you need to understand what they cover, what they're, so you can make sure you can optimize that contract and that it's even a contract that you want to have. So, like you
Good
talk about
point.
the MNT codes or the CPT codes in the contract. We're here to talk about what you can negotiate and what you can't negotiate, really. So, really, negotiating CPT codes is something where you do have the ability to influence what your contract looks like. Do you ever negotiate for CPT codes beyond just the MNT codes? Things
I
like
have not.
glucose monitoring, remote patient monitoring, tobacco cessation services, anything like that?
I have not. I know you have experience with that. I do not have experience with that. So I'd like to hear your experience with it.
Well, some of the ones I mentioned, I think are out there. Once again, you have to know your skill set, your competencies, some of your specialty credentials. So, once again, tobacco cessation counseling, you might have a credential. Lactation consulting, you might have a credential. If you have, I know you have a CDCES credential, that can open up some of these other things related to glucose monitoring, right? So, think about those things. I know the Academy of Nutrition and Dietetics, they have wonderful resources. They have a resource that includes all potential CPT codes that dietitians may be qualified to provide. So look at that resource, go down that list, and just expand your thinking. Ask for coverage. No harm in asking. They might say no, but if you don't even ask in the first place, you may be boxing yourself in where you really don't need to.
I think that's a good point, but I also want to say it should be in that contract. Explore, do your homework, explore before, make sure you can get it into that contract. So, another thing that I think is really important to know, because, these contracts are all boilerplates now, you want to make sure that lawyers look at it, but I will tell you they're all pretty standard. So, my feeling is you look at it once and it's the same contract. But what I think that we have to be mindful of when you're negotiating the fees, that if you are negotiating a contract and it says we're going to give you 70% of Medicare allowables, understand, remember, we are RDNs, we are not MDs. So what do we get with a Medicare allowable? We get 85% of Medicare allowables. So if you're getting 70% of Medicare allowables, you're getting 70% of 85%. That's really stinky.
It is, right? So, to what degree do you think you can really negotiate that payment rate versus just deciding I'm walking away, it's not worth it?
I have done both. So in one situation, I said, I can't do that. I don't think you understand. I only get 85% of Medicare allowables. So what you're saying is you're going to take 45% of Medicare allowables from me. I said, I'm pretty good at math. So one would not budge. That's it. That's all we play. It was a Medicare Advantage plan. I said, well, I really don't want to participate then. And then another, when I pointed that out and kept pushing and pushing, I was able to get it up to like 90%. Is that still great? I mean, you're still minus 25% of whatever the set Medicare allowable is. But just know that. If you want to work for that, that's up to you. It's not for me to say how much you want to work for, but just know that when they're saying Medicare allowables, you're only getting 85% of Medicare allowables.
Yeah, that's a really important point. I think something else when it comes to this whole fee negotiation, what you can and can't do, where you can be effective. I think we have to realize that when you're a solo business or a small business, unfortunately, you don't have the leverage that larger organizations and larger practices have for negotiation. But that doesn't mean you have to roll over and play possum with them, right?
Right.
The other thing it also means is what you have to do it within the laws. And there are laws against price fixing. So, while it may seem like, well, I could become strength in numbers by Lucille, you and I, let's get together, let's get our other buddies together, and let's all go together to this payer to negotiate rates for all of us. It's like, no, 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 no. There's laws against price fixing, and that's what it's considered. So, you really, an individual or an entity can only negotiate on its own behalf when it
Right.
comes to setting fees. So just be careful there
Yeah.
because some people look good in orange jumpsuits, but I don't think any of us want to
No, I don't
try
like
that
orange.
on.
I love red, but I don't like orange. But I'm so glad you brought that up. I'm not such a great social media person, but every time I go on social media and I look at what the dietitians are sharing in terms of reimbursement and practice management, sometimes I have to take a deep breath and I want to say, stop discussing fees. You cannot do that. And then I think nobody really wants to hear me say that. But it's true. You
Yes.
cannot be discussing fees. Is something going to happen? Is somebody going to scroll or, these websites? Well, you just don't want that. You don't want to take that chance because you cannot do that. So, talking about fees on social media could be considered as price fixing.
So part of us paying it forward is like learning from the school of hard knocks, right? You know, people make mistakes. We make mistakes. People who are listening to this, you're going to make mistakes. But the main thing is, what do you learn from the mistakes? So, what are some lessons you've learned from your experiences that you want to pass along to everybody?
So there's a couple of lessons. First of all, like I said, the one lesson with one HMO, the provider relations person didn't even understand what an RD was. And after digging a little bit, we kind of realized that. But we only realized it after we signed the contract and we started
Mm.
seeing people. And they had a lot of people refer to us for weight management. And we didn't get paid for any of those. And it took months and months for us to unravel this mess. And then he left because some of these provider relations representatives, they're here and there. So we learned, wait a second, no, we need to see it in writing. We're going to do a test. We're going to do a test claim to see if it covers. The big issue is always weight management, Marcia.
Mhm.
It's not diabetes. It's not chronic kidney disease. So that was the one thing that we really did learn. Wait a second, make sure it's in the contract. Make sure I have your cell number to contact you and your email. And we're going to do one test case, see if we get paid before we say, wow, that's so great. Let's announce it to the whole community that we're now on blah, blah, blah health plan. So I think that probably is the best lesson that I learned.
Yeah. I think some of the other lessons we've talked about is the importance of reading the contract before you sign it and make sure you understand what it says. Even if they're boilerplate and they all, you say, oh, that's the same, that's the same, that's the same. Read through it. If you don't understand the terms they're using, ask them. I know we've talked about, should you have an attorney look at every contract, not look at every contract? With the boilerplate terms, you could have one looked at and that may carry you through for everything. Or you may ask a lawyer, like, what are some key things I should look for in the
Right.
contract? What might be
Yeah.
some red flags? But never sign anything without reading it and make sure you understand. I know you've run into situations where you amended a contract in a way that you thought was okay, and then it came back to bite you in the end, right?
Right. Absolutely. Those things happen. So you have to be very mindful. And I guess we just keep saying the whole thing is do your homework, because that's really important.
Right, right. Very true, very true. So, where do you keep your contracts after you sign them?
Oh, you know what? I got to tell you, Marcia, that's what you hit on a mistake. I have contracts from 30 years ago. So when I was cleaning things out, we moved our office two, three times over the last 35 years, and then closing it down, doing telehealth. Some of those contracts got missed, and I don't know where they went, if they went into the shred bin. But the good news is you can contact them. They have to have a copy of your contract. What I would do now, everything is so much easier. Just scan it. Well, you're going to probably get it through a DocuSign anyhow, so make sure that you put it on a jump drive, save it somewhere so those contracts are all there for you. So you
That's
could
a great
refer
piece of
back.
advice. Great
Yeah.
piece of advice.
Yeah.
So, let's just kind of summarize the key points that we went over today in terms of these insurance contract negotiations. Understanding what you can negotiate and what you can't. You can negotiate CPT codes. You may be able to negotiate some payment rates, right? We didn't mention, but you may be able to negotiate how long you have to submit a claim or to file an appeal. If something gets denied, maybe not. Those are
Mm-hmm.
things you may be able to do, but you want to do your homework. You don't want to sign anything without reading it, right? And you do want to try to negotiate. And in some cases, you do need to prepare to just walk away if you decide this really isn't a good opportunity for my business.
Correct. Correct. I think that summarizes it brilliantly.
So, hopefully, did you learn anything today by listening to this video? I hope so. And if so, Lucille and I want to let you know that we have a full series of programs that are designed for dietitians in all stages of business, whether you're just starting out, you're starting to grow and diversify. They're all reasonably priced. We've got short webinars and workbooks, so take advantage of them. And follow us on Instagram because we have lots of these conversations like we've had today out there, once again, all designed to help pay it forward and help support you in your endeavors.